Dr. Ben Sessa is a child and adolescent psychiatrist in Bristol, England, and has done numerous studies on various psychedelics with the Imperial College of London. And I just learned also as a subject.
Yeah, I mean, it's been a great privilege to be with that team for the last 10 years. And they've looked at mainly neurophysiology studies, mechanism studies with LSD, psilocybin, DMT, MDMA, and then a ketamine study I did with a different university. And in those studies, some of the time I'm administering the drug as the study doctor, and also on other occasions I'm receiving the drug. So I've had the privilege of receiving all 5 of those compounds legally, which is quite an unusual position.
Now, wouldn't they consider that a little bit biased, given that you're a psychedelic therapy advocate, to be a actual member of one of the studies, giving your opinion on how it worked? And
not really, because these are mechanism studies. These are looking at pictures of brains and how the drug works in a neuroimaging way. So I don't think there's much opportunity to bias that. It's kind of what your brain chemistry is doing. So
they're not trying to cure a mental illness you have. In other words, they're just
no, exactly. Yeah. So these are studies on healthy people, not clinical subjects.
Right. Or, so you got to tell me. I've looked at it, and I've got a lot of social media play the imaging studies on LSD, and you see this really bright brain. What does that actually tell us? Can MRIs really tell us anything important about a psychedelic?
Oh, absolutely. I mean, I think one of the things quite exciting about modern research with imaging is it's allowing us to go back to a lot of those studies of the 50s and 60s, but with these modern techniques. They can tell us a great deal. They can tell us about how the drugs work in the brain, which teaches us about the nature of the drugs themselves. But
down to receptors?
Absolutely. Because with functional MRI, rather than just a static kind of anatomical picture, you actually get a real-time dynamic moving movie of the brain in certain circumstances. So you can give the infusion of the drug, and they're always given intravenously, and then whilst the person is in the scanner in real time under the influence of the compound, you're getting them to carry out cognitive tasks, emotional tasks, calculation tasks, so you can actually look at what parts of the brain are being used, oxygen use, blood flow, these kinds of things, which really tells us a lot. But my kind of understanding of how the classical psychedelics work through those studies are that there's an increased connectivity between all the different parts of the brain, almost like a childlike brain, where the narratives that we switch off in adulthood, the possibilities and the imaginative qualities that in adulthood you lose to some extent, on the classical psychedelics, they kind of reopened, which kind of intuitively fits.
That's what people say.
Yeah.
When I first took LSD, I remember, I was a teenager, and it was like being a small child again, playful, building sandcastles on the beach. Yeah.
And things that are usually banal and everyday are suddenly fascinatingly interesting, like, wow, a pen, like it's like you're seeing it for the first time, which is a bit mad, but kind of fun. And it interests me to understand what's going on in the brain in those circumstances.
Well, to me, the most interesting study is the one that came out recently showing that psychedelics increase dendrite density, actually neurogenesis, and increase plasticity. If it actually is the case that psychedelics increase neuroplasticity and dendritic density, then Terence McKenna's theory that maybe we evolved through the use of mushrooms and psilocybin makes a lot of sense, because those of our species that ate the mushrooms may have had a distinct advantage over those who didn't.
I think that work is very, very early stage. There's been just a couple of small studies that suggest neurogenesis. And of course, neurogenesis is the holy grail in neuroscience, because chronic degenerative problems, things like multiple sclerosis and things like Alzheimer's disease, stroke, spinal injuries, these are all, we've always thought of these as irreversible, because central nervous tissue does not grow back. And if you snap a spinal cord, you cannot get it to join. So finding the holy grail of something that could regrow nervous tissue is the holy grail.
People swear by microdosing LSD. They swear they are receiving tons of benefit from that.
Yeah, microdosing is certainly the flavor of the month. A lot of people are talking about it, and there's a couple of very structured organizations, as you know, that are looking at it. I think my stance on microdosing is we still haven't got any randomized control studies with placebo control to demonstrate it yet, so we have to hold on to our enthusiasm a little bit.
Right. I'm very enthusiastic.
Yeah, and absolutely. There's no doubt that there are thousands, if not tens or hundreds of thousands of positive anecdotal cases, but as you know, anecdotal cases don't mean toffee when it comes to science.
I actually like a museum dose. That was a term I think Sasha and his group came up with. Just above the microdose, or you could just start to feel LSD, but you still know how to tie your shoes. You could still talk to people, and but it kind of brightens the world a bit, gives you a little more energy.
Yeah. And like you say, that by definition isn't a microdose. Right. That's a threshold dose.
Museum
and
dose,
that's a I speak to so many people that go, oh, hey man, I'm on a great microdose today. I'm really buzzing. No, you're not on a microdose. Right. By definition, you shouldn't feel it if you're on a microdose.
So microdose would be 15 micrograms or less?
Well, it's different for different people. I think the bottom line is if you feel it, you've taken too much to be a microdose.
Right.
So one aspect of microdosing that I'm not that keen on is, as a psychiatrist, the reason I like psychedelics is because I don't like the idea of frequent daily dosing. If we're going to do that, you may as well take SSRIs, part of me feels. Now, of course, I'm not for a minute saying, that I have no doubt LSD and psilocybin are much safer and better than SSRIs. But do you understand what I'm saying theoretically there?
I do. I wouldn't suggest microdosing to cure mental illnesses, because I think that the full-on macro experience that gets, especially with a therapist, it gets you thinking differently, is what's important about psychedelic therapy. But if neurogenesis really is true, then microdosing, what people like to do, 3 days on, 1 day off, that may very well be a nootropic. It may enhance your cognition even when you don't have a diagnosable mental illness.
Yeah, absolutely. And I think this is the thing. Microdosing is for a different population of people, I guess. Like I was saying, what I like about psychedelics is I don't like psychiatric drugs. I don't like the idea of taking drugs daily. So I'm much more enthusiastic about a proper high dose, threshold dose combined with psychotherapy to overcome whatever the issue is, and then not need to take drugs of any kind, psychedelics or otherwise, at all, because you're cured and you're better.
But you might anyway, right?
You might do them anyway, for other reasons, for sure. I think the jury for me is out on microdosing at the moment. I can't wait to see the data as it comes in and see how that's used by people. So that'd be great.
Well, let's talk about your study, and let's talk about the one you're doing right now. Ben is halfway through a study using MDMA to treat alcoholism, the first study of its kind, and a question I have always wondered myself. In fact, in my documentary film that I'm making right now on MDMA, we follow two veterans, one of whom was a severe alcoholic before he started the study. He has not quit cold completely. He's not abstinent now, but he doesn't abuse alcohol anymore. And so that's one piece of anecdotal evidence that, at least to the degree that alcoholism is a result of trauma, MDMA and healing the PTSD could be very helpful with alcoholism too. Tell us whatever you can now. I know you may not be able to release all of the results, so you're halfway through, but tell us what's so far.
I mean, I think the first thing to say is the rationale behind the study is quite right. It's kind of as you described it there. We knew that MDMA was showing a lot of promise in treating trauma, and particularly PTSD. And working in addiction services, I know that underlying a lot of addictions, and particularly alcohol addictions, is trauma. So we kind of put 2 and 2 together and came up with 5. Therefore, MDMA therapy would treat alcoholism. But it's interesting, actually, Emanuel, because we're seeing a different sort of effect emerge. We've only done 6 sessions so far, but in all of them, we're almost seeing a classic psychedelic effect, which is not really expected. We're seeing this peak experience, this kind of white light, enlightening new way of looking at the whole of their lives, psychospiritual experience, which is quite unexpected. And, you know, I can't draw too many conclusions, but that is interesting that it's having that effect above and beyond just simply tackling index trauma.
Yeah.
And it's a really welcome observation to be having that. And of course, then when people have this peak experience type effect, almost like an Osmond type LSD alcohol effect, they then decide, well, I just don't need alcohol in my life anymore.
Right. Well,
So-
I can tell you, we're highlighting 2 or 3 individuals in our film that went through the MAPS MDMA study for PTSD, but I actually phone interview at least, about a dozen folks who went through the study in order to determine which ones I wanted to use in the movie. And every single person that I interviewed talked about how MDMA gave them a sense of self-love for the first time. And it made me believe that PTSD is largely a moral identity disorder. It's when you've interpreted your trauma in such a way that you blame yourself. Like children who are abused, raped as children, it's safer to blame themselves than to believe that the world they've been born into and their caregivers, for example, are dangerous people. Plus, the child adopts the attitude of their perpetrator oftentimes too, even becoming more empathetic in order to understand the moods of their perpetrator so as not to anger them, etc. In a real tragic, ironic way, I think abused children become more sensitive, more empathetic, and therefore more likely to take on their abuser's attitude. And so, you know, we talk about MDMA allowing the individual to hold a space without fear and recode their memories, etc. But there's another mechanism of action, a little more woo-woo, but it's one that everyone I've interviewed tells me, and that is simply that they now realize it wasn't their fault. They love themselves again. So maybe you're seeing something like that.
Yeah, and I think that's the thing. And I describe it like a classic psychedelic experience, but with this extra bonus of love and warmth and self-love, and that's very important. And, you know, we spend a lot of time with the patients saying that. You know, I've been working with abused children for 15, 20 years, so I resonate very much with what you're saying about the child taking on this victim mentality as a neuroprotective effect in some respects. You know, it's so overwhelming to take on that they've been so humiliated and fooled and abused by their caregiver that it's almost a design fault in the human brain. I see it, that children, rather than having the understanding and wisdom to say this shouldn't be happening to me, they say, this, I deserve this, it's my fault, I'm a bad person, I need to be exploited, I'm really sorry that I've hurt you, to the parent who's hurting them. You know, it's extremely sad. And then they carry these narratives into life as adults, and then what was a neuroprotective survival mechanism turns into a cluster of antisocial behaviors as they go into adulthood. And it's very hard to undo those narratives. And you're quite right, what MDMA seems to do in that position is just gives them the permission to realize that actually they are good people, and they always were. And above and beyond that, which is its even more magical quality, to even empathize with their abuser, which is an extraordinary thing. You can be in psychotherapy for 20 years and not reach that level of enlightenment. To say, you know, I can't condone what he did to me, I'm not sure if I can forgive it, but my God, my dad must have been in a very bad place to do that to his 6-year-old daughter. And, you know, that's an extraordinary admission of empathy that is very hard to get to in traditional psychotherapy. And I think from that position, the healing can begin in terms of rewriting their own narratives.
Well, this was actually my experience. I actually first took MDMA when I was 16 after reading the Newsweek article, the first ever article on MDMA in April 1985. And I sought MDMA out in 1986 for therapeutic use. I did it with my best friend, and I talked about my childhood trauma, talked about my father, and was able to forgive him. The surprising thing that I didn't know was going to happen, because I didn't even realize that this was going on. I always knew I hated my father. But I realized I'd hated myself. So it was like, in learning to forgive my father, I found a place of compassion and empathy in me that made me love myself. I never moved back in with him, but I struck up a relationship with him again and was able to be at his bedside when he passed away just 5 years ago. So
it's very powerful.
Yeah, and I certainly don't feel I would be the person I am today if I had even waited until my 20s to take MDMA. I feel really privileged that I had come across the drug for therapeutic intention when I was still a teenager, when my brain had greater plasticity. And I think this is something that audience might be a little sketched out about. What you're talking about giving MDMA to teenagers, but they should know that the FDA is requiring MAPS to do studies on children. They wanted to begin at 7 years old, and I think Rick said, no, let's wait till 12. But I do believe that for childhood trauma, the earlier you can strengthen those feelings of self-appreciation and snap the brain out of these locked-in patterns of self-loathing, the more likely a person's going to heal and have a fulfilled life.
Yeah, and it's a topic that comes up quite a lot when I'm talking and presenting. As a child psychiatrist, I think maybe sometimes the audience think I'm talking about giving psychedelics to children, and I have to say that at this stage, apart from that MAPS thing that's on the horizon some years away, there are no studies in which anyone's proposing giving psychedelics, including MDMA, to children. But what I can say from my own practice with teenagers is, with children and teenagers, I have seen too many young people lose the battle to complex PTSD and kill themselves. Mm-hmm. I've seen too many children take their own lives because they are unable to engage in the psychotherapies and medicines that are being presented to them. So the trauma is so close, it's still only a few years away. And I absolutely hear what you're saying, that I can totally see the day where MDMA therapy can be applied to teenagers, and why not?
It's coming.
Yeah, why not? And I think, some people have concerns about giving children medicines of any kind, and nobody has those concerns more than those of us working in pediatrics, who have a very appropriately cautious and careful approach to medicating children. But we also, and one of the things you learn very early in pediatric prescribing is it's actually unethical to not give children something that is demonstrated to be safe and efficacious.
I agree.
To withhold it just because they're a child is a deeply unethical thing. If it's safe, it's efficacious, and it can be delivered in a way to improve the quality of their lives, you give it to them. You wouldn't say, we're not going to give children cardiac drugs or drugs to cure their leukemia because they're children.
Right.
So why would we have the same approach towards psychiatric medication?
Right. Well, it's the drug. Some people are against psychiatric medication, period. But with illegal drugs, people believe that they're immoral, that it's sinful, or that they simply produce pleasure so much so that you lose control and do things you regret. I think people have a very simplistic understanding of illegal drugs. Obviously there is an element of pleasure to MDMA, more so than most psychedelics, but that's not, I think, even its primary effect.
I think it's just sloppy pharmacology education to make that arbitrary distinction between illegal and legal prescribed drugs. As a doctor and as a scientist, these are all just psychoactive compounds with a vast range of goods and bads and positives and negatives about all of them, and the fact that we also happen to be operating along this arbitrary Misuse of Drugs Act that categorizes things into these bizarre groups with very little relevance to their pharmacology.
Do you use class A, B, C in the UK?
In the UK, we have Schedule 1, 2, and 3 for the classification of medicines, and then we have classes A, B, C for the classification of illegal use.
It matches the schedule.
It's pretty similar.
A is Schedule 1, B is Schedule 2.
They're similar because there's two different groups.
Where's ketamine in the UK?
I think ketamine is class B or C, I think.
Because it has some medical acceptance.
Yeah. So
what about for depression? Are UK doctors like in the US prescribing it now for depression?
Yeah. So we're starting to get a few ketamine clinics springing up. And the way they get around it is once a drug has a license for one condition, you can use it off license for other conditions. So you could effectively use penicillin to treat depression because it's not licensed to treat depression. It's licensed as an antibiotic. But so that's what they do with ketamine.
Now that's going to happen with MDMA as well.
We think so. Yeah.
It'll be approved for PTSD, but it could be prescribed for relationship counseling even.
Yeah, absolutely.
That's going to be interesting.
If you look at our own study, I was very keen on moving away from just PTSD. That's why we chose this alcoholism study, because everyone's doing PTSD, apart from Alicia Danforth, who's doing the study with autism, social anxiety and autism. We wanted to do something different. So we chose alcoholism. And also partly because our treatment of alcoholism is so poor in the UK and in the US. You're talking about 80 to 90% relapse rates, 4 years, within 3 to 4 years post-detox, with the very best medicine can throw at you. Now, that's outrageously bad. We were doing better than that in the Victorian times at treating alcoholism.
How were we treating it in the Victorian times?
Well, the temperance movement and these kinds of things were actually probably more effective. So, and we got a bigger problem in terms of its dissemination across culture, and it's worse. It's getting worse and worse. It's worse in the UK than it is here. You've got more restrictions around alcohol, which is good. But, we figured that if we can do any better than that, we're onto a good thing. So that's why we chose alcoholism. And I've just seen how damaging it is. Of all working in addiction services, there's no question that alcohol is the most dangerous compound.
Right. I actually think much of the public's perception of other drugs comes from their perception of alcohol. So they think that other illegal drugs are as bad or worse even because they're illegal, because they're thinking about the destructive effects of alcohol.
Yeah.
But alcohol is really the worst than anything else.
It really does skew it. There's a whole load of physical and mental health problems that are associated with putting a lot of ethanol into your body, which are partly cultural and social and psychological, but also simply pharmacological and toxicity issues that many of the other drugs don't have, including, ironically, heroin. Heroin is a very dangerous drug in terms of using it as a street drug in the way it's used in terms of injection, and of course all the crime and the stuff that goes with it.
Of course, that is largely prohibition and the adulterants on the market.
But just from a pharmacological toxicity point of view, if you, in this hypothetical position, were a meticulous injector of heroin and very careful on all those things, you'll probably live a longer life than the person who drinks a bottle of vodka a day. Because from a toxicity point of view, alcohol causes far more damage to multiple organs than do opiates.
And in Switzerland and other pilot programs in Germany and other countries, they do have heroin maintenance programs, which is helping people tremendously. Free, pure, legal heroin up to 3 times a day. You turn in your driver's license. It's not take home. You go into a clinic, so you can't give it to anyone else. And these people are able to improve their lives, put food in the fridge for their children, get jobs, and you would never even know they were on heroin.
Yeah, absolutely. And they've piloted such things in the UK as well, and kind of come to the conclusion that it's going to be too expensive to do that.
If you look at the cost savings in crime and other issues related to addiction, there may be an overall savings for if we had opiate medication programs, including heroin maintenance.
And certainly safe injecting rooms where people can go, and that's where all the drug injecting takes place. For all those kinds of reasons. But the other good thing about this is it's about accessibility to services. If you're turning up at this room, not only are you going there to do your injecting, get your medicine, but there's a social worker there, there'll be a doctor, there'll be someone to help you with your benefits and your housing, and it's an opportunity to engage people in services by going along to
There's a number
places.
of cities in the U.S. now that are working on it. I don't know who's going to be the first, but we're on the verge now because the epidemic here, over 60,000 fatalities last year.
That's outrageous, yeah. It's certainly big in Canada as well, isn't it? They're a bit further ahead.
They are, they are. Insight in Vancouver is one of the first and should be a model. Yeah. But let's go back for a second. I re-listened again to your TED Talk on the way here, and it's brilliant, by the way. I want to say, thank you. Its title is MDMA the Psychiatric Antibiotic? And in that talk, you talk about your work with adolescents and trauma and alcoholism and drug addiction, et cetera. And like Gabor Mate, equate addiction with childhood trauma.
One of the factors, I mean, multiple factors, but quite a strong factor in my experience. Yeah.
And I wanted to ask if you had considered and thought about the role of epigenetics in addiction, because my reading of this new field of biology is that now they're realizing you can transfer trauma to your offspring, that trauma and a heightened stress response could be inherited if your parents or grandparents went through trauma. So it may be a person is born with a kind of predisposition towards addiction or towards anything that relieves their stress and anxiety, even if they didn't suffer trauma in their childhood. And I do know, working with a lot of parents who've had children who've died from opiate overdoses or poisonings, however you want to look at it, that they often criticize Gabor because they say, you know, I raised my child and did everything I could for them, and they suffered and died from their addiction, and there wasn't any undue trauma in their life. And so the question then is, does MDMA help with epigenetic stress response? And I do know that there is an epigenetic researcher that may be tagging along in the phase 3 studies to do before and after epigenetic tests on some of the subjects.
Okay, I mean, first thing to say is I'm not an expert on epigenetics, so I can't really talk about that with any great authority. I would love that to be the case. I would love that to be the case. In a way, it matters less to me whether it is the case or not, because what we do know is it has a very real here and now effect on psychotherapies, which we can tangibly alter, can't we?
Have you heard about the oxytocin receptor profiles that seems to encode for MDMA's empathy response, that people with one version of an oxytocin receptor gene feel much stronger empathy when they take MDMA than those people who don't have that? And do you do genetic testing on your subjects to figure that out?
We don't do any genetic testing, and this has come up. We have tried to make this, for partly financial reasons, as sort of simple and basic as we're just looking at the main things we are looking at. And again, I'm not an expert on the particular polymorphisms around the oxytocin issue, but what I do know is that we're in the infancy in MDMA science. We're in our infancy as scientists here. I have no doubt that there is a broad range of responses to MDMA, as with all medicines, depending on your genetic code. And it would be lovely to get to a point where we can do reasonable screening, especially your role with Dance Safe and, harm minimization of ecstasy users. It'd be great to be able to know your carrier type and say, oh, I shouldn't take this drug. This one's okay with me, but not in combination with that. And my liver can deal with that, but it can't deal with this. Absolutely. So I would love to get to that point. I
think we are getting there with 23andMe and other new, genetic testing may one day soon become a part of your doctor's, profile about you.
Yeah. So, it's not my area of expertise, and we're not doing any carrier typing or genetic testing within our study. But maybe in the next one, it's about kind of hooking up with local geneticists who just say, please, can I have a drop of your blood samples to do my own things? Yeah.
Let me ask you this. The 6 people so far in your study, how many of them would you say enjoyed the experience versus, man, this was really hard work talking about my trauma?
This is a really good question, because not all of them did enjoy it. One of them really had an unpleasant experience from start to finish on pretty much both the MDMA sessions he had. But even he said it was beneficial. And it's interesting that, and you do see that, especially with classic psychedelics, don't you? You don't have to necessarily enjoy it to have a benefit from it. Do you enjoy your leukemia surgery? No, of course you don't enjoy it, but you do it and you get better from it. So similarly, they don't all enjoy it, but all the others have actually actively enjoyed it. They've said it was profound, it was pleasurable, but difficult, because they're there to discuss difficult things.
Do you use the MAPS protocol? Male, female team?
Yeah. I mean, the protocol is kind of broadly similar to most psychedelic studies. The principles being the importance of screening, the importance of non-drug preparation sessions, at least 2 or 3 weeks, a drug session, followed by non-drug integration sessions, a second drug session, followed by non-drug integration sessions, male-female co-therapist pair. The drug sessions themselves are relatively non-guided. A lot of time is spent inside with the headphones on and the eye shades on. The client leads how much to bring. We don't really push them. And an integration session the next morning as well. So those are the principles across pretty much all the psychedelic studies.
And are you the therapist?
I'm one of them, yes. So I'm the male and the female, for all of them. So I'm working with a clinical psychologist, Dr. Higbed, and she's the female half of it. So there are elements that are like the MAPS protocol, but I wouldn't even call it the MAPS protocol. I'd call it the psychedelic protocol, which goes right back to the beginnings. And we I talk a lot about underground therapies these days as well, and one of the things that is often missed out of the underground therapy are the preparation and integration sessions. Right. There's plenty of people out there who'll say, yeah, come to my place, I'll give you MDMA, but they don't say, I'll see you for 3 weeks before I give you MDMA, and I'll see you for 3 weeks after I've given you MDMA. And I think those are the bits that are often missed out in the underground.
Well, this is why I think there are more integration circles starting up, at least across the United States. All the major cities have them right now. Usually
to back up the poor underground therapists that don't do them as part of their practice.
Well, it'll serve that use. I don't know if that was its intention, but lots of people take psychedelics and have these transformative or just very powerful experiences, even in recreational environments. And so you publicize your integration circle. People come together to talk about and interpret and try to make them a positive experience.
That's a good thing, yeah. And we're doing the similar thing in the UK as well, putting together those things as well.
Mm-hmm. Great.
Yeah. I was just going to say a thing about the psychospiritual experience on MDMA, because it's quite interesting that we've seen this. I've got this sort of hypothesis of my own that when we were setting up the study, if you look at all the other addiction studies, and this is the world's first addiction study with MDMA, there's a wealth of anecdotal experience around classics, thousands of cases of LSD stopped me drinking, magic mushrooms stopped me using cocaine, so there's lots of those anecdotal experiences with classic psychedelics, but there are very few out there of my ecstasy use stopped me drinking. There's a few, but they're nothing like the others. Now, looking at that phenomenon, and then looking also at the phenomenon that all of the psychedelic studies for addictions, going right back to Osmond, but also looking at Krupitsky's stuff with ketamine, and all the stuff with Matt Johnson and Bogenschutz, what they all found was it was the strength of the psychospiritual experience that caused the greatest sobriety. The more you saw God and had a mystical spiritual experience, the more likely you were to give up the drug. Mm-hmm. Now, we went into this study then thinking, well, that's a bit of a problem, because we know that MDMA, Matt Baggett showed about 10 to 15% of first threshold MDMA cases report a psychospiritual experience. But that's nothing like the 80 to 90% you get with LSD and psilocybin.
Right.
So we thought, hang on, maybe it ain't going to work because we're missing that bit.
Right.
But what we found, as I said, is that doesn't seem to matter that we're missing that bit, because the trauma bit MDMA is very good at.
And the self-love.
And the self-love. Yeah. But also, my pet theory here is that if you look at the way MDMA is taken recreationally, it's usually a very externalizing drug. Mm-hmm. Not everyone, but most people, when they take ecstasy, it's go to a party, shout, scream, lasers, bang, 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 music, take other drugs, drink. It's all this externaling party material. Whereas if you look at the way LSD and psilocybin are taken recreationally, it's much closer to the way we do it clinically, isn't it? It's lie in a dark room around a candle listening to Pink Floyd.
I'm not so sure you're right about that. I mean, I've taken MDMA hundreds of times in my life, and I have never taken it at a rave. It's always with a small group of friends, doing it the way you're talking about.
As I said, not everyone, but actually, if you look at the majority, I think it's definitely changing these days.
It could be different in the UK.
Yeah,
though.
okay, maybe
LSD is a party rave festival drug in this country.
That's interesting, actually. Maybe that's a UK thing, but if I look at ecstasy users in the UK, the vast majority are young people at nightclubs taking ecstasy.
Yeah.
There's not that, there are some, and increasingly more, but less people who take it in a pseudo-clinical, close-knit, home-based thing. More and more do, but the majority are people standing in nightclubs.
Ecstasy was introduced in the UK in the late 80s as part of a party scene, right? The British DJs brought it back from Ibiza. That's how historically and culturally, that's how it was introduced. Whereas in the United States, we had this decade-long underground therapy movement that spread it around the entire country, even before Michael Clegg started selling it in Texas nightclubs. And I didn't know anything about its recreational use when I first found it in 1986. It was, I saw it as a therapy drug.
So that's interesting. There's definitely a different pattern there. And I mean, I think the British are quite hedonistic.
I certainly know that when I look at the media, because I have alerts for various drugs, Google alerts that fill my inbox, and I read about different drugs. The UK press is by far the most alarmist and hysterical when it comes to illicit drugs, even with cannabis. It's like the U.S. has improved over the last 20 years. They're much more reasonable. And though I put two and two together and think the anti-drug culture in the U.K. kind of manifests the hedonism and drug abuse. When you tell young people that these drugs are just bad hedonistic pursuits, no benefits, only risks, and there's something wrong with you if you do them, how else could you as a young person orient yourself towards them except take on this rebellious way of using it? So that's why, this podcast is called Drug Positive. The idea being that we need to start looking at these substances for their benefits. This is to get young people to start saying, hey, I can use this responsibly. Less is more.
Yeah, absolutely. Right? I mean, I'm shocked by the UK drug policy and its rigidity and its failure to even look at the evidence and to change and to look at the rest of the world. I was at the United Nations conference in 2016 on global drug strategy, and hearing all the 188 member states putting their position, and it's so embarrassing to see England up there with the sort of Middle Eastern countries that cut your arm off for smelling of cannabis approach, and we're up there at that end. And there's some wonderful countries down the other end, the United States in terms of its cannabis approach, Czech Republic, Portugal, Spain, Germany, France, Canada, that are down the other end of the spectrum and are so impressive and getting good results. So yeah, it is embarrassing where we are in our drug policy, and it's dangerous.
Yes, right. I was just going to say there's about 50 people a year in the UK dying. Now, I know some of those stats from MDMA. Now, I know some of those stats they just found MDMA in the bloodstream and it may not have been a cause of death. But even if half of those, even if 25 a year are dying in the UK, that's a lot. You don't hear those stats coming out of other European countries. No. And in the Netherlands, where they have the highest per capita use of MDMA of all of Europe, you have hardly any fatalities.
I agree. I think the rigid, archaic drug laws as they stand in the UK make the situation more dangerous. And, when I sort of see the press now of so-and-so died in a nightclub of taking ecstasy, I don't say this awful drug, I say this awful government with blood on its hands once again for the unnecessary death of a young person. It doesn't need to happen. So we've got to try and shift it and push it. But there is a very strong anti-drug lobby. But it's a peculiar position, actually, Emanuel, because I think everybody off the record, police, the courts, even the government themselves, know that they've dug themselves into a real hole with these drug laws, and they want to get out. But I think they're trying to find a face-saving way to get out. Because they've told people since 1971 that these drugs are evil, dangerous, killer things, and, we will never be soft on drugs has been the repeated mantra of every government since then. And so it would seem like such a terrible U-turn to alter that position. I guess the other thing I can just say that we're really keen and excited to be part of the MAPS Phase 3 project that's coming to the UK.
Oh, you have a clinic in the UK?
Well, it's still underway, the setting up. But, as you know, Rick's got kind of, I think, 28 or 38 pairs here in the US. And what he's doing, and the original plans were that they were going to concentrate solely on the US and get the FDA license by 2021, and then he'll turn to Europe and get the EMA license however many, 2, 3, 4 years after that. But what the plan now is that we're doing FDA and EMA simultaneously. So we're looking at several Europe-wide international sites. So we have got a group set up now, a European MDMA Phase 3 group. So we've got Netherlands, Germany, Czech Republic, and UK. We're going to do at least 2 pairs of therapist sites in the UK, plus those other groups.
And is this going to expedite MDMA's legalization in Europe too?
Yeah, so we're going to have the same. We're going to have simultaneous FDA and EMA licensing in 2021, if it all goes to plan.
Let's get it to the Middle East as quickly as we can, too. That was Richard Rockefeller's dream before he died tragically, was to get MDMA to war-torn countries that just perpetuate these cycles of conflict and violence, largely from unresolved trauma.
Yeah.
Nothing like war to traumatized. I think our civilization's at a crossroads right now, because certainly nothing else that we're doing is really helping to stop conflict,
No, I mean, there's actually some preliminary discussions in Imperial at the moment looking at either MDMA or psilocybin as conflict resolution tools. So there's some work looking at that. I was just thinking, actually, in terms of the other thing I'd mention is, in the States here, and certainly through MAPS, there's a very strong emphasis on combat PTSD. I'm a PTSD therapist who's been working with PTSD for almost 20 years, and I must have seen in my entire lifetime 10 combat vets. So it's interesting for me.
We have a lot more.
Yeah, for me, PTSD is nothing to do with combat PTSD. It's child abuse all the way, you know. And interestingly, when you look at combat PTSD, that's also usually child abuse. You take 100 people into war, 98 of them come back fine, 2 of them come back with PTSD. You explore that. Hey presto, they were abused as children. So even combat PTSD tends to be about early trauma and the vulnerabilities that come from that.
I think part of that choice was political, though. Right, because it's generally conservatives who are more opposed to illegal drugs because they're very law and order. They don't understand what psychedelics are about. And so by emphasizing healing veterans, you can break through that block a little more.
And of course, you then get a lot of criticism from some sort of vocal parts of the psychedelic community that you guys are just facilitating war.
Oh my God. Don't even get me started on that.
I know. And that's just not the case.
Every veteran that I interviewed, again, for the film and also the ones that I didn't choose to be in the film, they knew the wars were a bunch of bullshit. They knew it. And in fact, coming home and having your friends and family say thank you for your service and being unable to understand that you were really over there protecting oil pipelines, that's part of their traumatic experience.
And the concept that we're patching them up to send them back to war is ludicrous. That's like sort of saying we're going to patch up child abuse survivors to send them back to child abuse. They don't want to go back to this.
None of these folks are going back
We're
to
patching them up to keep them alive and allow them to live their lives. The idea that we're patching them up to send them back to war is ludicrous. And
don't get me
started. It's interesting that some people do think that.
We have a tendency to divide ourselves up into groups. We're very groupish. I think it's genetic in us. And I really do think it's the downfall of our species. And one of the reasons I love doing work around MDMA and conflict resolution, because I think anything that can help us expand our empathy and understand that our perceived enemies may not be so different from ourselves has much more potential to save our civilization.
Yeah, I quite agree. Yeah. So there's a lot of errors and divisive ideas and misconceptions in the psychedelic community, like there are in any communities, aren't there? One of the things that's been very much on my mind in recent weeks is the issue of sexually inappropriate behavior within the psychedelic community, and I think it's important that is on the table. The Me Too movement is absolutely applicable to our community, like it is to all others. Some would argue it's a particular problem in our community. You have this position of older men with positions of authority, with younger people, young girls, throwing in psychedelic drugs that alter your judgment. And it's sickening that we have these problems within our community, but we absolutely must not take our eye off the ball. We are not immune from this problem at all.
Absolutely.
And it's really important. And when I look out at a sea of faces in a crowd of psychedelic enthusiasts, we are looking primarily at white middle class men, and that's kind of sad. Where are all the black faces? Where are all the actual people that would benefit from these medicines?
Well, I can tell you there's many African American. Molly is very popular in the African American community. I think what really is going on is that in the United States, people of color are much more hesitant to come out and acknowledge that they're drug users because their communities are targeted.
They get unfairly targeted. Absolutely. So we have to work really hard to increase inclusiveness within the research community, within the psychedelic recreational community, certainly in the UK. I think people are open to this. I don't think there's frank racism against this. It's just it doesn't seem to be as represented as it should and could be. And another thing here is about tackling stereotypes around psychedelic users. When I look at my patients are hard, shaven-headed, tattooed, drink lager, smoke cigarettes. They are not in the hippie community. You know, they would run a mile if I talked to them about chakras and kundalini and lit some incense. They are not in that hippie world. And I've part of my work over the last 10, 15 years has been battling the hippies, tackling the stereotypes. You know, I think there's a lot of pseudoscience that is unhelpful. And as a scientist, I find it unhelpful. I mean, I'm respectful and inclusive of people who dig that stuff. But we have to be really careful the way we use that, especially with the regulatory authorities. So, for example, if I was going to propose a protocol for MDMA to a regulatory authority, I wouldn't say, oh, it's great, it opens the heart chakra. That ain't going to work. I would say it induces a positively felt mood. And so we have to be careful, because whilst I don't want to exclude those people who enjoy that part of it, we have to realize what went wrong at the end of the 60s. Why, by the end of the 60s, did we then enjoy a 40-year hiatus of dark ages? One of the things that went wrong was the language that was used, and the thing that actually closes down accessibility to people who aren't in that kind of genre. So, and when we do psychedelic studies, why is it always Indian batiks on the walls and sitar music playing? Why not a picture of Britney Spears and Manchester United?
I so fully agree with you. I've taken a lot of psychedelics, and I love exploring my mind, and I do have a spiritual perspective, but that's been always very personal for me. Psychedelic drugs and my relationship to my higher self, whatever you want to call it, it's never been steeped in any outer cultural norm. And this is one of the reasons I've yet today have never taken ayahuasca, because I've never wanted to take it in a South American traditional context where the imagery is all about, you know, jungles and jaguars, and mother ayahuasca and all this. I have smoked DMT, and I've had very, very powerful experiences on that, but I never had any kind of jungle vision on it. And so I'm waiting to find, because I know you need a guide, someone who's done it before, but I'm waiting to find someone who's done it a lot, and then get a small group of friends and do it without all the accoutrements of South American shamanism. I don't want that. Not only is it a little disrespectful, but I think it also would incorrectly color my experience. I want the medicine to speak to me directly, not through a filter of culture I don't belong to. So I'm waiting for that.
And it's important. It's important for the personal experiences. But like I say, bringing it back to the clinical, these patients of mine who are very much outside the psychedelic culture and would run a mile if they felt they had to be in it, good God, do they need this medicine? You know, these hard people who are not hippies in any way, they need MDMA more than anyone. They are broken, damaged, traumatized people from fragmented communities. And we need to, I work for them. This is what I say to my patients. I work for you. Your agenda is my agenda. I will meet you on your terms. I'm not going to ask you to meet me on mine. So, and I think this does mean tackling stereotypes with a lot of people in the psychedelic community who say it's got to be done in this way because that's how we channel the energies. It's like, you know, it's got to be done in this way because there are 60,000 cases of untreated PTSD in the UK that need to get through the door of a standard NHS clinic. They can't all fly off to Esalen or Peru, you know? We need to bring it to them in a way that's accessible.
I think MDMA has less of that. I think MDMA has broken out of the psychonaut community because it doesn't dissolve the ego so much, and it tends to produce the kind of therapeutic effects that mainstream psychotherapy is going for, relationship type of healing, as opposed to the spiritual stuff, despite what you're seeing in the alcoholism study. I think I found that very interesting.
And that's why I'm really aligning myself with MDMA these days much more than the classics. I think you're quite right. It really resonates with what I've been doing all these years with PTSD anyway. It really resonates with this incredible ability to selectively impair the fear response whilst leaving the other faculties intact, which allows the patient to do trauma-focused psychotherapy in a safe emotional platform. In some ways, it's not that magical. All you're doing is normal therapy, but you're taking away specifically the fear bit. A really interesting anecdote actually about this. So when I was like 18 and I took MDMA for the first time in 1990, I remember lying there after a rave with my friends, and we were all lying there all loved up, and we were saying, oh wow, this is beautiful. Try and think of the worst thing you can imagine. And we were lying there and we went, let's all imagine our mums dying. And we went, it's not that bad, and what was really interesting about that is, this is years before I knew about MDMA therapy, but that was essentially what MDMA therapy is. It's just, it allows you to talk about and think about something that normally would be difficult and avoidant.
Right.
And I guess critics would say, well, you're just high and you're talking rubbish. And one of the things I asked my patients the next day after the MDMA session, all of them, I've said, look, I think we did some really good work yesterday, but, maybe you were just high. Were you just talking a load of rubbish? Can you even remember what we talked about? And they always say, no, I was high, but I remember it all. I wanted to say that. I wasn't under any obligation. Right. I wasn't feeling pressured. I wanted to say it. I can remember all of it, and it still sticks today.
That's right. You bring those memories, those experiences back with you. They become a part of who you are. Absolutely. And people on MDMA, they know that, because a very, very common thing people say is it's not just the drug talking. Yeah. While they're on it, they say, I'm not just saying, I really do love you. I really think you're a great person.
And you remember it the next day. Because, of course, there's many compounds that reduce the fear response. A bottle of vodka reduces the fear response. A bag of heroin will reduce the fear response. But they're very messy drugs because they massively impair the cognitions at the same time. So that's what's really peculiar and particular about MDMA. It's its specificity to reduce the fear response. But the other things you can remember, you can reflect, you can think, you can debate. All of these faculties are still intact, and that's quite remarkable.
Are you familiar with Jim Grigby's study on fear extinction training with rats in Denver?
I'm not in any detail. I do know of Jim.
Yeah, so this is very, very interesting to me. They his team's theory is that the healing component of MDMA doesn't require as much talk therapy as we think it does, because they have given MDMA to animals after traumatizing them and shown that they can reduce their trauma. They call it fear extinction training. Essentially, you take a rat, you put it in a cage, you electrify the floor. Yeah. Then they bring the rats back up and just show them the cage, and they start having all these physiological responses as if they've been traumatized. And then they try to take the rat through a protocol and see how quickly they can make it lose the fear of the cage. And they've been doing this for decades now without any use of any drugs, just to try to understand how trauma works and how desensitization therapy might work. Well, Grigsby and his team in Denver a few years ago added MDMA to the equation and discovered that the rats were healed much more quickly than the rats that didn't get it, suggesting that you don't need to talk about the traumatic experiences. You just need to remember them while you're on the drug, and it will disconnect the amygdala or the emotional memory from the episodic memory, so that even in the future, now when you remember the past trauma, you no longer trigger the amygdala and the fear. And of course, when you do add talk therapy in with it, you also think about it differently. MDMA helps you develop new neural pathways of thought around what the meaning of that trauma was, et cetera. And of course, is more helpful than just remembering it. But this might suggest why so many thousands of people have reported tremendous therapeutic benefits from the use of MDMA,
without therapy,
even in recreational contexts.
Yeah, no, absolutely. And that the effect on reducing the amygdala response and boosting the prefrontal response and increasing the capacity to see the good in things and not be scared by things is a well-recognized physiological response above and beyond whatever psychotherapy you're doing. So, yeah, absolutely.
All right, I'm going to put you on the spot here. I'd like to talk to you about your own personal use of MDMA. You obviously took MDMA before you ever got interested in it. You mentioned that earlier. You didn't even know it was therapy. Was it a party setting? And how did you become what you become? MDMA must have been a big reason why you're now one of the world's foremost advocates and researchers on MDMA therapy, right?
Yeah, I mean, when asked this question in the past, I would always be able to say, no, I don't want to talk about recreationalists. But, as I've got older and more confident, I kind of don't mind saying that. For God's sake, all it does is put me in the majority of people within my...
Recreational use means recreational. We recreate ourselves in various ways, going out and exercising, hiking, playing sports. It's all about becoming a better person. And if you use drugs intentionally for the same reason, that's fine. It's when we use them unconsciously. I would say when you're using them unconsciously, you're not using them recreationally, recreationally.
Yeah.
You're just being unintentional about it.
Yeah.
So there's nothing wrong with recreational psychedelic use.
No, there's not. I mean, I think in a position as a professional doctor, you do have to be careful what you say. You may have your own scruples and moral compass wanting to say something, but also recognize that if you do, it could be damaging for you and indeed your cause. So I do have to be careful what I say about that. What I am in this very fortunate position to be able to say is, yes, I've taken MDMA because I've also taken it legally. So I can put myself on the record that I've taken MDMA and that wasn't illegal. But yeah, I mean, I think I'd be pretty crazy to sort of suggest I've had no experience with recreational MDMA, because I clearly have. What's important is that doesn't bias my position as an MDMA scientist, because would you ask, if I was sitting here talking about lithium or ECT or something, would you say, so have you taken lithium? It's not part of the argument. If I want patients to use MDMA therapy, not because I have or haven't taken it, but because we've done tens of thousands of cases and demonstrated its safety and efficacy. So you could bias the argument one way or the other by either having taken it or not.
Right. Yet, the MAPS protocols... And afterwards, when it becomes legal, there will be a requirement that to be an MDMA therapist, you have to go through MDMA therapy yourself.
Which I have. So I've done clinical MDMA administered by Michael and Annie Mithofer as part of my training as an MDMA therapist. And I have to say, it's so different from recreational ecstasy. I was staggered by how different it was. It was just a different experience altogether. And that's kind of useful, because when designing these protocols for these studies, and one of the questions is, do we let people do it if they have taken MDMA, or if they haven't, should they be naive or not? How many times should they have done it?
Right.
In a way, it's all academic, because what I've said is, look, I don't care if you've taken it 150,000 times, you ain't going to have had it like this, because it really does feel different. And in fact, everybody that's done it so far said, this is not like the ecstasy experiences that I've had.
Well, my situation was kind of backwards, right? Because I read the Newsweek article and I sought it out and did it for therapeutic purposes the first dozen times, really, with one friend, or maybe a couple other friends, and I told them, because I was the guy who introduced all my friends to MDMA. Nobody knew what it was in Florida back in 1986. And I was always like, oh yeah, you sit around, you have personal conversations, very therapeutic. You opens your heart, you talk intimately. And then one time I invited 15 friends over to take it, and only a couple of them had been people that I had done with before. So the majority of them had never taken it. They'd all taken LSD, and they were like, after half hour, they didn't feel anything. And they started becoming skeptical. And I was like, just you wait, don't worry. And then I go into the other room and for 5 minutes, and I come back. They had put on a Tex-Mex song, Joe King Carrasco, taken the broom out from behind the kitchen refrigerator, and were doing the limbo and dancing, and it instantly became a dance party. And you got to remember, this was before any rave culture at all. There is something about all these people taking it together that just spontaneously produced a dance party. So I went with the flow, and I was a bit confused. I had a good time, but this is the first time, maybe I'd done it a dozen times, that we didn't all just sit around and have personal conversations. It was just a fun party. So, even though I've been this advocate for the therapeutic use of MDMA, I learned very early on that people like to dance and have a good time when they're on it, and there's nothing wrong with that either.
It fits that, and I guess that's the amphetamine component to it. There is the stimulatory edge, which you don't get with classic psychedelics, and that does really fit with the music, doesn't it? And so the first time I took it was 5,000 people in a massive outdoor rave, with lasers and loud music and DJs. But it's interesting, and I hadn't really thought about it, that in the American context, where you had the preceding psychotherapeutic use, a lot of people's first experiences were these quiet, pseudo-clinical type environments.
Late 70s and halfway through, through most of the 80s, I think most people who took it in that kind of, quasi-therapeutic, intimate, personal conversation way, right, before the rave culture ever really started.
And do you think then, Emanuel, there is a greater psychospiritual component to MDMA than a lot of people get? Certainly when they do it in the nightclub setting. Do you think if more people took it lying around in semi-darkness like they take LSD, they would talk about glimpsing God more on MDMA?
I think intention is very important. I do think it's less of an otherworldly drug than LSD or psilocybin or DMT, especially. It's more of a heart experience than it is a transcend your ego experience.
A mystical experience.
But people who are open to a spiritual perspective, I think they can and do get a lot out of MDMA as well, right? There's no other drug that I think produces the we're all one feeling as much as MDMA. I mean, empathy, right? When you love yourself, you're much more capable of loving others and understanding and the compassion that we have for others. Those are hallmarks of every major religion in the world, right? Treat your neighbor as yourself, etc. And MDMA, I think, does that more than LSD or psilocybin. Those might have the sort of I am God experience, but MDMA has the we're all brothers and sisters experience.
This is true.
Both of which are religious principles.
Thank you. I agree.
Yeah. Well, anyway, Ben, thank you very much for joining us. It's been wonderful.
Yeah, I've really enjoyed it.
Have a safe flight back this evening to England. Yeah.
Thanks, Emanuel.
All right.
Good luck.